Might a therapeutic diet, like a ketogenic diet, or the practice of intermittent fasting, help with the mitochondrial problems in an illness like ME-CFS, even though, of course, those mitochondrial problems are driven by the illness pathology and not by dietary factors? My name is Patrick Usher. I'm an ME-CFS patient and author of the book Understanding ME-CFS and Strategies for Healing. And today I'm talking with Dr. Courtney Craig, who has spent most of her professional, academic and personal life dealing with or learning about ME-CFS. And Dr. Craig actually had an article published in a scientific journal about the use of ketogenic diets and intermittent fasting for ME-CFS. And so today she's going to be breaking down some of the science of this for us, as well as talking about how to actually practice intermittent fasting so that you can get the most benefits and what her own intermittent fasting routine looks like. Before we get going, I should say that Dr. Craig has offered viewers of this channel 15% off her video courses on ME-CFS and nutrition. That's a pure discount code, not an affiliate link. You can find details in the description box below. So speaking of diet, I know that you have written a paper that was published in a journal about the use of diet in ME-CFS. Would you like to tell us a bit about what angle you were taking in that research?
Sure, that gets me back to the mitochondria piece. I was pretty obsessed with mitochondria and mitochondrial function back then. I still am. So that paper is about diets that are specific to the mitochondrial dysfunction that we see in this condition. Because at that time we were really getting an explosion of research looking at doing seahorse studies and seeing that the mitochondrial dysfunction that was kind of ubiquitous in these conditions in all different cell types. And I started to really get into, using therapeutic diets to kind of help mitigate this. And so I call them mitoprotective diets. So they're kind of protective to the mitochondria and in that way reduce oxidative stress on the mitochondria. And those would be diets like ketogenic diets or fasting, caloric restriction type diets. And we have quite a lot of literature, particularly on the former, for ketogenic diets, which have always been used for epilepsy and other sort of brain diseases, like neurodegenerative diseases. And we've learned a lot from those and their ability to reduce inflammation, particularly neuroinflammation, and also oxidative stress. So that was kind of the basis of this paper, and I drew a lot from that research. So we have research in neurodegenerative diseases like Parkinson's and MS and ALS that uses ketogenic diets as a therapy to help relieve symptoms.
And in working with patients, who may adopt intermittent fasting or a ketogenic diet, what would you tend to observe as a response?
It's hit or miss. Some people benefit a lot from it, others do not, right? That's kind of how it goes with everything in this condition. But for me personally, at that time, I was doing a lot of fasting and I was also doing ketogenic diets as well. And it really felt tremendous benefit for me. And yes, I started recommending it to some patients and some were also benefiting a lot. And what kind of benefit? So for me, it helped so much with my brain fog. At that time, I was having a lot of brain fog. That helped a lot. And also just a bit of more of an energy boost. For others that I was working with, a lot of pain relief, particularly like fibromyalgia patients, the more pain predominant post-viral condition. They're finding that fasting really helped relieve their pain, which is very interesting. But again, it's about sustainability. I don't necessarily think these diets are sustainable. If you are an epileptic and you can't be controlled with medication and you only have a ketogenic diet, that's one thing. But if you're kind of doing this therapeutically for these conditions, I think again, maybe it's something to do for a couple months. I usually recommend people try it for at least 3 months and then cycle back out and see how you do. And if you have a period where you're feeling worse again, try it again for another 3 months. So using it therapeutically like that. However, with intermittent fasting, you can kind of implement it differently in different ways to have it almost all the time, depending on how you do it.
So with the ketogenic diet not being sustainable, is that because you have concerns about health implications long term, or is it because, those bananas over there look quite nice and I want to eat them? Is it just not practical because it's just hard to stick with as human beings because we like sweet stuff? Or
Yeah. All of the above. I mean, I think
All of the
food,
above. Yeah.
we need to enjoy food, and food has such a social aspect, that we need to, it's part of our life. And I don't think that we should hinder ourselves that way. We can get very negative ideas and kind of, it can lead to perhaps disordered eating, which would not be helpful. So, and also there are definitely health risks associated with it, particularly on the long term. You can get vitamin and mineral deficiencies. Some people are more predisposed to kidney stones on it. Also, there isn't a lot of fiber in that kind of diet. And we know that gut dysbiosis is pretty ubiquitous in these conditions, and long-term low fiber, I don't think is a good idea. We can talk about that later as well. So yeah, it's hard to maintain mentally, emotionally, but also does carry some risks. Anytime you're on a super restrictive diet, there's always going to be risks.
Right. Yeah. And with the intermittent fasting, like what would be when you're working with clients, or when you thought about it for your own self as well, like how would you construct that? Would it be maybe 18 hours where you're not eating, having that kind of feeding window? Would that be the sort of idea?
Yeah, so it depends on what you're trying to achieve, right? So if you want to raise blood ketones, you need to go more than 18 hours. It probably needs to be closer to 22. It will also depend on what your diet looks like when you are eating. So if it's already pretty low carb, it'll be easier to get into ketosis with a shorter duration. So that it depends, and also variability from person to person. But, learning more, I wrote this paper, I think, I don't know, over 10 years ago, and learning more about what we know in these conditions, I have to wonder now if the benefits that patients see with this are due to the mitochondrial effects. Is it due to the anti-inflammatory effects that these diets maybe do? Or is it due because of we're increasing NAD, like we're learning about that too during fasting? Or is it simply because we're giving our gut microbiomes a rest? So that's very interesting to me as well. And I think I'm actually maybe leaning towards the latter a little bit more, because just not eating, we're not fermenting things in the gut. We're kind of starving the gut microenvironment, and maybe that's producing the beneficial effects here. So in that regard, even longer duration of not eating could be better, 24 hours or so.
That's
So
very interesting. So it's
it
almost
is
like maybe you
interesting.
have like a day off in a week, kind of from eating. Would that
Mhm.
be like part of a protocol, just to pick a day and you just don't eat on that one?
Yeah, that's kind of how I do it now. There's lots of great apps that you can keep track of your fasting protocols, but that's what I try to do. I try to eat a very early dinner. I don't know, sometimes 4 o'clock in the afternoon or so, 4:30 in the afternoon, and then I'm doing most of my fasting at night while I'm sleeping, so it makes it easier to do that. And I just do it, yeah, once or twice a week, or to just kind of feel how I need it or how it feels good. But could it just be due to you're kind of starving your gut microbiome there for a bit?
This video is sponsored by Courtney, the new artificial intelligence sidekick designed specifically for a select group of illnesses, including ME-CFS and long COVID. Now, Courtney is not another ChatGPT. Instead, the platform has indexed pretty much every single paper, every single conference, every single transcript from a YouTube or podcast discussion in relation to ME-CFS and long COVID from the last 10 years. So when you ask Courtney a question, you really get a very detailed answer from a wide variety of sources, which allows you to make the best possible decision for your own health. It is just $2 a week, but you can get a further 10% off using the code Patrick10. Please follow the links down in the description box below. The first 3 weeks are entirely free.